So you have the two terms. I give you the two terms. The one is called seizure. Another term most of you are already familiar, and that is called as the epilepsy. Got it? Now there is a difference between the seizure and epilepsy, but most of the time we thought that the seizure and epilepsy is the same just because they have the same symptoms. I am agree with you, but again, incidence matters. How much times they are occurring, that matters. That basically classifies the diseases. Okay, so in the case of seizure, what is happening inside our brain? You already know that there is a presence of neuron. Fine. Now these neurons, they communicate with the other neurons. As you can say, the cell number wise, we are billionaires. We have 89.1 billion neurons in our brain. Fine. And each neurons communicate with the other neuron in order to function smoothly. One neuron communicate with the other neuron, other communicate with the other neurons. So there is always a communication between the different neurons, and these, you can say, this communication is mediated by the electrical activity. This electrical activity which is occurring in between the neurons or inside the one neuron, that is, you can say, contributed by the ions. That is contributed by the ions like the sodium ion, calcium ion, and potassium ions. Fine. So sometimes due to deficiency of these ions, or due to the deficiency of the, you can say, the energy currency, the fuel, the glucose, hypoglycemic condition, these lead to what? They exert the stress on the neurons. Neurons are not properly communicating just because of the lacking of their, you can say, the prerequisite requirements, like the as I said, like the electrolytes or their energy currency. Cell have the stress. Basically neuronal cell have the stress, so they start firing abnormally. So abnormal electrical discharge. Now what happens if there will be an abnormal electrical discharge in the brain? Now once there is an abnormal electrical discharge in the brain, it means now brain function is really compromised. It is compromised. So it compromised in the three level. Okay, in three ways. The first was is a sensory problem. Okay, person not perceive the things correctly or accurately. They have you can say problem in the sensory. Apart from that, they have the problem with the motor skills, the motor functions. We know generally we are walking, talking. Okay, apart from that, we have the fine hand movement. Okay, we have the gross, like the catching a ball. These all things are the upper motor function. Okay, so these motor functions, they are also compromised when basically our neurons fires abnormally. So sensory problem, abnormal, you can say, motor problem. Apart from that, in the most of the patient with the abnormal electrical problem, or you can say the epileptic foci in their brain, end up with the cognitive, you can say, the abnormalities, cognitive problems. Cognitive problem means they have problem in the thinking. Now you have the rapid, you can say, the electrical firing inside your brain. How can you think smoothly or calmly? You can't, just because of there is a, you can say, problem in the neurons are not in their proper electrical positions. Okay, the current is high. Okay, so there will be a problem in the cognition, there is a problem in the sensation. Apart from that, there is a problem in the motor function. Got it? So these three problem occurs in the seizure. Now that's a fine, amazing. Now I am understanding. But what about epilepsy? Epilepsy is, my friend, something different. It is like you can say spontaneous. Spontaneous means anytime, any state it comes. Okay, it doesn't need a electrolyte deficiency only. It doesn't need the hypoglycemic conditions. It's anytime come. Fine. And it's a recurrent. Recurrent means one time it came, again it came, again it came, again it came. Okay, so there is a recurrency related with the symptoms, and that condition is called as the epilepsy. So you cannot label the seizure patients as a epileptic patient. Now this differentiation also help in the management. Okay, there's a different protocol for managing the seizure, and also there's a different protocol to managing the seizure. Fine, no problem. Now the neonatal seizure is a age-specific seizure syndrome. That's something which you have to understand. As I said you, why it is age-specific seizure syndrome. Seizures comes in a different age too, but why it is age specific? It is a age specific just because one thing which you have to understand is their hyperexcitability. Neuron is there in hyperexcitability condition. Fine. Apart from that, the neurons is vulnerable. This age group is itself vulnerable. I remind you once again, what age group? 0 to 28 days. 0 to 28 days. Fine. And in between this 0 to 28 days, the 0 to in between this 0 to 28 days, 0 to so in between in the 0 to 28 days, this 0 to 5th days is the most vulnerable days. In the subsequent slides, you will also come to know that not only their neurons are in excitable state, there is also a certain, you can say, neuropeptide problem. Means you know that neurons are working. Okay, it is not only working electrically, sometimes it's work chemically. We also have the chemical synapse in our brain. Fine. And that need the neurotransmitter. So sometimes there is a hypersecretion of certain neurotransmitter. You can take the example of CRS, corticotrophin releasing hormone, that also exert the stress on the neurons and baby have the seizure. Got it? No problem. This is called as the age-specific seizure syndrome. Fine. Now we already discussed that the neonatal seizure is something abnormal electrical discharge in the brain in the newborn, typically occurring with the first 28 days of life. No problem. Now the one thing I want to hammer in your mind is that 100 live birth of a baby. Fine. In this 100, you can say 1000 live birth, among these 1000 live birth, there is a chances of 1.5 to 14% baby will suffer from this neonatal seizure. So incident rate are high. It's a common. So as a medical student, as a nursing student, for preparing the competitive exam, you must know about this disease. Okay, there's no any compromisation. You must know about this disease. Now let's move to the next slide. Now we will discuss the etiology. We already aware about the certain etiology, as I discussed initially, that there will be a metabolic disturbance like the hypoglycemic condition, hypocalcemia, as well as the hypomagnesemia and hypohypernatremia. Now you know the mechanism why hypo can cause this condition, just because we need ions. Okay, we really need iron for our proper neuronal health function. So there will be a hypoglycemia, energy is deficient, that exert the stress on the neuron. Hypercalcemia, calcium is needed to maintain the electrical potential between the neurons membrane. Then we need the hypernatremia, or basically a sodium deficiency, or basically the elevation in the sodium amount. Got it? No problem. So there's no need to further discuss the acute metabolic syndrome. Now just pay the attention over the CNS infection as a etiology of the neonatal seizure. Now the CNS infections is the two, as I mentioned. One is called bacterial meningitis and another one is called as the intrauterine infection, or also called as the TORCH. See, bacterial meningitis, you know that meningitis is basically inflammation of the meninges. What are the meninges? Basically the outer coverings, the layers of the brain, like your pia mater, arachnoid matter, dura matter. So if there will be any virus or bacterial toxin that will get interfere with this membrane, fine, and result with the inflammation in this membrane. Sometimes there will be a pus forming bacteria, okay, sometimes not a pus forming, fine. So this bacterial meningitis, you can take the example for exam point of view. Just take the two example. First one is the group B, streptococcus, okay, and E. coli. These both bacteria cause the bacterial meningitis, which eventually lead to the neonatal seizure. No problem. Now then we have the intrauterine infection in the mothers. If mothers have any toxoplasmic infections, okay, or any other infections, either mother have the cytomegalovirus infection or either have the herpes simplex virus infection, okay. In their prenatal time period, if mother is suffering from these diseases, okay, then child have the baby, the neonates have the seizure. Got it? No problem. Now then some of the cerebrovascular abnormalities can also cause the neonatal seizure, but my friend, here I am going to emphasize over one thing, and that is hypoxia ischemic encephalopathy. Hypoxic ischemic encephalopathy, it is one of the most, you can say, the known etiology, or one of the most, you can say, causative etiology of the neonatal seizure. Okay, if there is a 100 cases, then in 100 cases, among this 180 cases is just because of the hypoxic ischemic encephalopathy. Now you are now wondering that what it is. Actually, it is basically a less oxygen supply, okay, due to the ischemic condition in the brain, and The cause of hypoxic ischemic encephalopathy is diverse. Okay, it is diverse. It is maybe it's because of the bacteria, or it may be due to the, you can say, the abnormal vasculature, the abnormal vessels. Got it? So this is one of the most causative agent. Then we have the arterial and venous ischemic stroke. Okay, this arterial stroke or either the venous stroke. Okay, both can cause a seizure in the neonates. Then we have the hemorrhages. Hemorrhages diverse, different kind of hemorrhages. Take the example of subarachnoid hemorrhage, okay, subdural hemorrhage, intradural hemorrhages. These different type of hemorrhages inside the brain. We have the blood vessels, okay, and if that blood vessel get occluded or that get ruptured, that lead to the hematoma formation, basically a collection of blood, fine, and that is called as the hemorrhages. Okay, so we have the subdural hemorrhage. According to the area involved, we are going to nomenclature them, fine. So nomenclature is based on the which area of the brain is involved. Now till now we discussed the acute metabolic as a etiology of the neonate seizure. We discussed as a CNS infection, cerebrovascular. Now we have the one separate, that is called as the developmental. Developmental is something really very challenging. Okay, the one is multiple forms of cerebral dysgenesis. As we discussed initial part of this lecture, is that there is sometimes due to the abnormal gene expression or due to the deficiency of certain vital nutrients in the pregnancy time, fine, baby have problem in the development of the brain. There will be an abnormal brain formation, that is called as the cerebral dysgenesis. Got it? We have the different examples. Now you can see on the screen, fine. Sometimes there is a flattening of all the, you can say, curved surface of the brain. Okay, that is called as the gyrus and sulci. Sometimes they become flattened, fine, and sometimes there will be an absence of the corpus callosum, which is basically connecting these two hemispheres. Sometimes the one part is totally absent. Got it? Or there will be sometimes there is a microcephaly, brain is shrinkage or size is less. Got it? So these are the developmental problem. Now the thing which you have to keep in your mind is that the metabolic, okay, the metabolic problem, okay, CNS infection, cerebrovascular infections. These three can be managed. Okay, it can be managed. But if you're talking about the developmental problem, then it is very challenging. It need an ample amount of effort. It need an ample amount of time to correct it. Fine. So these are the diverse symptoms. One thing you have to understand, and that is most of the times you came across the symptoms in the neonates, fine. But again, in the other hand, sometimes you will not get the symptoms. Although the diagnostic modalities like the EEG, electroencephalogram, the MRI or certain blood investigations all support that baby have seizures, but the symptoms is subtle. The manifestation is subtle, means the symptoms is not prominent. Okay, you cannot absorb those symptoms. But although the report, the metabolic, you can say the report or the brain imaging that shows that baby have abnormalities, but the symptom is, you can say, silent, fine. So this is something which is challenging as far as this neonatal seizure is concerned. Now the first symptom is intense staring or rapid eye movement. Got it? Now another symptoms is unusual mouth movement. Then you have the blinking or eye rolling as a symptom, blinking or eye rolling. Got it? As I said, initially that there is a hyperexcitability of the neurons, fine. So neuron is not firing in a normal way, so there is not a normal expressions become, you can say, disturbed. Then there is a bicycle like movement of the legs, okay, and we seen in the video the muscle stiffness, a tonic, you can say, posturing, and sometimes there is a, you can say, baby forget to take a breath while they are sleeping, and that is condition is called as the apnea, pause in the breathing. Okay, pause in the breathing. So these are the some of the symptomatology. Remember that sometimes these symptoms are prominent, sometimes they are subtle. Then we have to prioritize the other, you can say, the other diagnostics modalities like the EEG, electroencephalogram. Basically electric encephalogram is basically measuring the electrical pattern of our brain. Okay, in the skull, baby skull, 20 leads are attached, okay, and that is attached to the monitor, and monitor will show the brain waves like the alpha wave, beta wave, delta wave, gamma wave, fine. And a pediatrician, notice those waves, okay, and find out the abnormalities. Whereas in the MRI, there is a you can say imaging of the brain scan is there, fine, and that clearly shows that which parts of the brain have the abnormalities in context of the structure. Got it? Then once in the baby, now we are discussing the diagnosis. Now once in the baby, if there will be a finding of the seizure, then we have to find the cause. Okay, the main accurate cause. If we find the accurate cause, then we can provide the target therapy. We can make the patient stable sooner. Got it? So for that, we investigate the blood, we investigate the electrolyte panel. Okay, we also sometimes take basically the you can say the blood glucose test. Blood glucose test is also very necessary. Blood glucose test is necessary just because during mostly the blood glucose level and electrolyte in the case of this neonatal seizure is important while baby have the seizure in their 1 to 5th day. In the 1 to the 5th day, if baby have the seizure, then there is a much more probability that this seizures is caused due to the either the hypoglycemic condition, due to the either hypoglycemic condition, or it's occurred either due to the hypercalcemic condition. So either there is a deficiency in the calcium or in the glucose. So that is something golden status in the diagnosis of the neonatal seizure during the 1 to 5th days. Got it? Now